So you've been told your back is shot. Maybe you've been through MRIs, physical therapy. You may even had surgery for your back. But what if I told you the real problem isn't necessarily your back or your spine, right? That perhaps it's possibly your nervous system. See, I'm Dr. Ray Peralta, a physical therapist, Marine veteran, run coach, exercise physiologist, and I'm also training something called the McKenzie Method. So, over 10 years, I've helped hundreds of veterans, special operators, and everyday athletes overcome chronic pain without relying on pills, injections, or endless surgeries. So, by the end of this video, you understand why your pain has been lingering for months or even years. And I'll show you a proven plan to calm your nervous system, rebuild your strength, and get back to running, rucking, and lifting pain free. And here's what we'll cover: why chronic pain isn't about damaged tissues, right? It's not always. See, a lot of people think who struggling or suffering with chronic pain think that it's a disc. I have a damaged disc, or I have a stenosis, or I have a arthritis in my spine, right? But that's not always the case. We'll talk about that. The alarm system analogy that explains why oftentimes it's this alarm in your body that just won't shut off, that's causing this pain signal or danger signal to go to your brain, and a simple movement strategies to take control of your back, including aerobic exercise that you can start doing today. See, most veterans are taught to think of pain like a tissue injury, right? Like if something hurts, something must be damaged, right? Something must be broken. But that's not the full story, right? So pain doesn't always equal tissue damage. Sure, sometimes it's some damaged tissue, but the thing is, most tissues heal in 3 to 6 months, right? If it's a minor kind of muscle sprain, that heals in weeks, right? Think about like a paper cut. You cut your finger, sure, it's going to hurt. It might even hurt more when you notice it, right? But then it'll heal, soft tissue injury, a week or two, couple weeks, done. So most injuries do actually heal. And even if you have like a broken bone, right? Maybe you fracture something in your spine, take 6 months, a year or so. But again, even that heals as well. So ongoing pain is less to do with some tissue damage and more due to a sensitivity of the nervous system, right? It's not just have to do with muscles, joints, or bones. See, with chronic pain, and chronic pain is defined as pain that lasts more than 6 months. And it's not everyone. Sorry, I don't even think it's a blanket statement. Sure, there are some people who have persistent pain that is due to tissue damage, but there are a lot of people who also have chronic persistent pain due to this hypersensitivity of the nervous system, right? And it could be a combination. It could be a mixed pain, right? It could be both some tissue damage, but also hypersensitivity of the nervous system. So it's like a switch that stays stuck in the on position. Even after tissues heal, the nervous system continues to fire off the alarms, right? So your back might have healed from that ruck mark injury years ago, from that fall or sprain, like maybe you fell off something, you landed on your back, but your nervous system still thinks you're under attack. Right. When I left the Marines, I had back pain so bad that I even couldn't sit for 10 minutes without feeling like my spine was on fire. But scans, I had scans, went to a doctor, right? They show like, sir, your back looks normal. The imaging doesn't show any major damage. Sure, you have some scoliosis, but it's not explaining this. I had back and leg pain. I had back pain radiating down to the leg. But what I learned was that my nervous system had been trained by years of stress and physical trauma to stay hyper alert, right? So point to the alarm system analogy. See, think of your body like a military base and its connected systems, right? You have your heart and lungs, the nervous system, the cardiopulmonary system, the integumentary system. All these systems are interconnected, right? So with normal injury, an alarm goes off, you take immediate action, alarm shuts down, and the healing happens, right? Let's say you were lifting, right? You take a temporary break from the lifting injury, allow the tissues to heal. In most cases, within a month or two, that thing heals up to 3 to 6 months, right? But with chronic pain, the alarm keeps going off even when there's no real threat, no real danger. See, the high stress and even some mental health conditions like PTSD, anxiety, fear of movement keeps the alarm blaring 24/7. And I used to deal with like depression, anxiety, and things like that were making me hypervigilant and causing more tension in my body. I didn't even realize it. So the solution isn't just fixing the base, right? Just fixing that disc or the vertebrae. It's resetting the alarm system. So your body's been stuck at DEFCON 1 for years, especially if you're a veteran, combat veteran. Even when the war is over, your nervous system doesn't get the message. So I worked with a special ops vet who hadn't run in like 10 years because of knee and back pain. But once he understood that his pain didn't actually equal permanent tissue damage, he was able to slowly start reintroducing running. We did like a run walk program. And Within 28 days, he saw like a 30, 40% reduction in his pain, right? It took him a bit longer to get further resolution, but he started seeing quick improvements. So point number three, movement is medicine, right? A lot of people don't realize that exercise is medicine. They think it's an afterthought. Like, oh, doctors just send me to PT because, just for insurance purposes. But no, the right type of PT, the right type of movement can actually help decrease the pain, right? The thing is, education alone doesn't solve pain. Just reading books about it, just learning about pain alone doesn't help. There's a topic called pain neuroscience education, right? There's lots of, famous speakers in the field of rehab who talk about pain neuroscience education. It can be very powerful, but you still got to combine this with movement. If you just read the book, watch the YouTube, like you're just watching this video here, and you don't take action, yeah, it's just entertainment. So you have to take action. You have to move in a safe and strategic way. And over time, you can retrain your brain and your nervous system and your body to start tolerating movements again, overcome that fear of injury. And over time, you could rebuild your back and help back and leg pain. I've done it for myself as well. So the key points, one, you have to start taking up aerobic exercise. So many people are afraid of moving their body. So I say, start simple, right? It could be walking, cycling, walking on a treadmill, anything that gets your body movement, right? You just get up out of your desk and go for a walk, can calm the nervous system and help turn down the alarm, right? It can start small. I tell people who work desk jobs, who have like back pain, let's say you sit 8 hours a day. First off, you shouldn't be sitting that long without a break, because sitting prolonged time can put more strain on your back. I know it seems like you're not doing anything. A lot of times people with persistent chronic pain, they just sit 8 hours a day. They're like fairly sedentary. They just have to start getting more movement in their body. And actually, being consistent with walking, in like 3 months, a lot of people actually get pain reduction just from adding more walking, more steps in throughout the day. So start small. Maybe start with 2 minutes of a walk. You get up out of your desk, walk for 2 minutes, and then come back. Do that every 2 hours or so, right? Do you want to get up out of your chair, walk for 2 minutes? So at the end of an 8-hour shift, if you'd walk 2 minutes, right, every hour or so, right, or even every 2 hours, you've walked anywhere for 10, 16 minutes or so. And as you start getting more comfortable, start adding longer walks. Maybe even go for like a 10 or 15-minute walk on your lunch break. And I think I tell people with walking, have like different sessions, like a morning walking session, an evening walking session, an afternoon session. So eventually you want to build up your endurance. So you could do a 30-minute walk, even if it's like broken up into smaller 5 or 10-minute intervals. But by end of day, you hit 30 minutes. And then you're able to do that every single day of the week. And then you can actually be amazed in like 3 months. Sure, the pain's not completely gone, but it's just much better just by adding more walking. It is mind-boggling how powerful walking aerobic exercise is. If it stresses you out, again, start with just 2 minutes. Try to do it slowly. If you need to do it slowly, as you get more confident, more comfortable, you can start picking up the speed, go a little faster, right? If the walking is just too much, strain on your body, you could also just get on a stationary bike for 2 minutes, slowly build up your time. Same thing with the bike. I prefer walking, but again, if you can't tolerate walking, you can do the bike, or even swimming if you have access to a swimming pool. And then also you want to do breathing exercise like diaphragmatic breathing. Big fan of diaphragmatic breathing to help activate the body's natural recovery system, right? This gradually builds confidence and even starts strengthening some of the muscles around your spine, oftentimes without flaring up your pain, right? Take slow, deep breaths, set a timer, maybe start with 5 minutes, build up to 10 minutes. Maybe do a morning session, evening session, right? Where you're doing this slow diaphragmatic breathing. I'm also a fan of alternate nostril breathing. It's like a yoga breathing technique, but that can help as well. Calm down the nervous system. Because oftentimes people with chronic pain are in a state of oversympathetic nervous system overdrive, right? They're in this fight or flight response. So what we need to do is go more into parasympathetic and calm it down. Sure, there's a time and place to be in the sympathetic, right? You're going on a brisk power walk. Maybe you're lifting something, but there's also a time and place when you need to relax and decrease the tension to help the back pain ease up. And over time, this can help as well, in addition to the aerobic exercise. And then the other thing you want to do is mobility, right? You start gently moving your spine. Oftentimes people with chronic pain hurt to move in every single direction. So what I tell those folks to do is do something, I'm just going to demonstrate sideways, like a cat-camel exercise. You can get your hands back. I'm just going to face the camera here, cat-camel, right? Boom. You could do this in a chair. You could do it standing. So essentially it's like a pelvic tilt. The pelvis is rounding. You kind of rounding and then coming up erect. Round, coming up erect. So cat, camel, or slouch. You're slouching your posture and then you're correcting your posture. Slouch to correction. You keep doing that back and forth. Maybe start with just 5 reps in the beginning, or even 1 or 2 reps. If you're in so much pain they can barely tolerate, start with 1 rep. Start building it up. So 1 to 3 reps, 5 reps, then 10 reps. And sure, you could take breaks. If you want to take a little break to do some breathing, that's fine. Right. Then eventually you're doing like 30 repetitions. Now you're doing this like 3 times a day. As you get more flexible in your spine, you start going a little bit further with the motion. Maybe even transition to hands and knees, a quadruped position, right? You're in hands and knees and doing what looks like the yoga cat camel stretch. Excellent mobility exercise for their spine. Oftentimes that helps a lot of people with chronic back pain. But again, you may have to start very gentle motions. You just slowly stretch into the pain, release, slowly stretch in. And over time, you can rebuild the spinal mobility and help decreasing the pain. And for a lot of people, if you're like, whoa, but that's way too much, you may just have to stick with breathing for first few weeks, right? Maybe stick with just breathing. You just lay on your stomach, and you'll call it, say, crocodile breathing. Just lay down on your stomach. Do slow diaphragmatic breathing, right? Again, 3, 5, 10, 15 minutes or so. Do that twice a day, 3 times a day, and then in addition to walking, and then you can start introducing the mobility. If your pain is that severe that you could barely even tolerate just the cat camels, that you just have to lay down. And if you need to, you could put a heating pad on your back or an ice pack, if that's fine. But over time, you do want to start introducing movement, start getting your body moving again, and start moving your spine. And there are some people, about 40 or 60% of them, who actually respond really nicely to lumbar extension, right? They call it lumbar extension. If you're familiar with the McKenzie method, this is one of the most commonly used exercises for people with back pain. So the McKenzie method, they actually have a book called Treat Your Own Back. So if you've been dealing with back pain, you can check out that book. Now, that book alone, it may not help you if you've been dealing with chronic pain and you need additional help. Obviously, find a physical therapist who's trained in the McKenzie method. I'm trained in that method as well. I actually have a diplomat in the McKenzie method. So if you've been dealing with some back pain, you're like, man, I needed some one-to-one support, professional help, work with a PT who's trained in the McKenzie method. But anyhow, one of the most common exercises, though, is the prone press up, right? Is lumbar extension. Again, doesn't work for everyone, but a lot of people, it's actually a surprising amount of people can just get back pain relief by doing lumbar extensions. Now, in the very beginning, they might not be able to move as far, right? They may be, ouch, it hurts. So you slowly push into the pain, slowly push into it. And then over time, you start going further and further and further back, right? And the same thing, maybe you start with 3 reps, 5 reps, 10 reps. You rest. Then you do like 3 sets of 10. Or another way of doing it is every 2 or 3 hours, get up out of your desk, do some prone press ups or that cobra stretch, or you stand up and do some lumbar extension. And then over time, it may take a month, 2 months, even 3 months. You're like, whoa, you start getting a lot more back mobility. Your back's feeling much better. And oftentimes that one exercise, in condition to walking and doing the breathing stuff, helps a lot of people with back pain. It's one of the most common exercises I use now. It's not the only one. I see if you're feeling stuck, work with a physical therapist, ideally someone who's trained in this MDT, McKenzie method, mechanical diagnosis and therapy. They have their book, they have their website. You can check it out, find a provider near you. And if you want to work with me one-on-one, I have a link in the description. You could check out my free training. You could also join my free school group for veterans or anyone who's, trying to get rid of pain and go back to activities. I love working with athletes, everyday athletes, and veterans who want to get back to running and lifting. Sure, I understand some people just want pain relief to do basic everyday life. That's fine if you're not like a high performer, but I'm really targeting the high performers, people who want to go back to running and lifting, because a lot of times the civilian who just will take it or leave it, will do it for like 2 weeks and didn't disappear, they oftentimes get incomplete recovery. And it's very unfortunate. But when you have that high performer mindset, you'll stick with the program, and then you can oftentimes get resolution of your pain and go further along on the process if you commit. So the key thing is committing, right? You have to commit to the plan, commit to doing the exercises, and commit to improving your posture, doing the breath work, doing the aerobic exercise. Because so many times people are like, sure, I'll do the PT exercise, but I don't want to do anything else. Yeah, you're going to get an incomplete recovery. But if you commit to the whole thing, a lifestyle, right, the healthy lifestyle habits with the PT, the McKenzie PT stuff, I've seen some amazing stuff. So if you're ready to take back control and finally ditch the nagging back pain, I created a 28-day program called Operation Pain Free. It's designed specifically for veterans and especially combat vets, special op vets who've tried everything else and are ready to move past the pills and the quick fixes. So you're going to get like 4 one-to-one coaching calls, comes to strength and movement plan, and progress tracking, so you never feel lost again. So you could click, again, the link in the description there. You could like book a call or join my free school group, and you can just send me a DM there. You could just email me OPF so I know that, hey, you're interested in Operation Pain Free. So your body isn't broken. You just have to, you're still alive, you're still breathing. It's just ready for you to fight for it again. You have to fight for it, put that in the work, and it is possible to recover from it, right? But it does also require that's a lifestyle medicine, lifestyle habits approach. So remember, chronic pain doesn't mean permanent tissue damage. With the right knowledge and the right plan, you can calm your nervous system and rebuild your strength. So stay in the fight, and your comeback can start today if you're willing.